Hello and welcome to the EduTalk Diabetes Series hosted by Easy, Biotone, and diabetes health and wellness experts. With the daily challenges of diabetes and the growing interest in health and wellness strategies, the EduTalk Diabetes Series supports building your wellness community by connecting you with diabetes health experts who share their knowledge and expertise on topics of concern to provide you the tools and resources to support and manage a healthy lifestyle. Today's expert is Micayla Dollinger, a CDCES RN, certified diabetes care and education specialist who works with patients in an acute care hospital. Micayla received her education from the University of California, Davis and California State University in Chico. She believes that knowledge is power and is passionate about spreading diabetes awareness and education. Let's listen and learn as Micayla shares daily habits to aid remission of type 2 diabetes. Understanding remission for type 2 diabetes is not always possible, but for many it is. Micayla reveals daily lifestyle habits and skills to help clients, patients, family, and friends manage their diabetes, whether remission is possible or not. Micayla helps us understand the possibilities. So let's listen and learn. And again, please be sure your sound is off and you're muted, and chat questions, which Micayla will address at the end. And welcome, Micayla. I appreciate you being here. Thank you so much. I know you have a lot to get to, so I will sign off and see you on the other side to answer the chat questions. Thank you.
All right. Thank you, Donnell, and welcome everybody. I'm going to share my screen in just a second, and we'll just start to work through the PowerPoint. Like she said, feel free to chat any questions so we can address them at the end. Okay. All right, so we are going to hop in here and start this PowerPoint. So once again, we're talking about the possibilities of remission and the daily habits to try and achieve this. And it's not always possible, but I want to talk about what it is and how we can possibly achieve that. Donnell already introduced me. I don't feel like I have to go through this, but my goals today is for you to understand what remission is, how to manage diabetes and work towards that goal, and especially be mindful of terminology. Words really do have a big impact, especially in the medical world. There's a lot of shame and stigma in the world of diabetes, and it's important to address people using research-based and evidence-based information and material, and also remember that people are not their illness, and it is a person living with diabetes. We don't want to ever define anyone by their illness or what is going on in their life. They are a person first. So really just watch your language. Remission. So the definition of remission has been determined with a consensus amongst many experts in the field. And what was officially decided on is that remission is the return of a hemoglobin A1C to less than 6.5% that occurs either spontaneously or following an intervention, and this must persist for at least 3 months without glucose-lowering medications, okay? So some people like to say reverse or cure. They are very exciting words to use. However, it has not been medically and scientifically approved to be using these terms because we are not curing diabetes, but we can achieve remission and live a life that is not so affected by diabetes. The definition might show up as slightly differently depending on what resources you use, but overall this was the one that was accepted. Let's see. Okay, so the basics. trying to achieve remission, and basic management of diabetes. We have food, activity, weight, and medicine. This is our arsenal, okay? And with this, we need to make healthy daily habits and lifestyle changes in order to work towards managing our glucose and hopefully achieving remission. So first up is food. We have our dietary interventions. Let me click down in here. Okay. So diet choices should be the primary focus, and they should be the primary intervention in order to achieve remission of diabetes. And diet as a primary intervention for type 2 can achieve remission in many adults and is related to the intensity of the intervention. So this specific quote, I wanted to read it exactly because it's important to understand that it is related to the intensity of that intervention. If we only make one little change in our diet, we might not see a big difference in our glucose management, and we may not achieve remission. But as far as the research goes and many different studies and group consensus, it is diet the number one thing that makes a change. Approved and recommended diets have been plant-based primarily, intermittent fasting, heavy calorie restriction, the Mediterranean diet, and DASH. So ultimately, in overall and the general research, everything says to consume less meat, especially less processed foods. So these are your things with added sugars, added sodium, added fats, fried foods, fast foods, anything you're getting in like the bagged snack aisle. And next would be to increase your whole foods and increase your plant foods, okay? And all of these have been researched and proven to improve diabetes management and potentially achieve that remission. Really important to remember, though, is that every person is different and every person is going to work well with a different diet. And some people might want to be plant-based and might want to go full bore in that direction. And other people might really want to eat their meat, and that's okay too. We want to make sure we're avoiding the processed foods though. So avoid the processed meat, consume the lean meat. When it comes to diet and food, we have to meet people where they are. Each person has a different cultural standing and opinion when it comes to food. They have different financial abilities, different access to food. Some people might be unsheltered, not have refrigerators, not understand. Maybe they don't have a grocery store nearby. So each person is very different and needs to be treated that way. So when we are talking about diabetes remission or diabetes management, we don't come in with a one-size-fits-all approach, and we don't say, this is what has been proven, this is what you have to do. We need to provide all of this information. We need to give the research-based evidence recommendations, but also find out what works for this person and how can we modify their daily habits, how can they change that to lean more towards these recommendations. Maybe the person that is eating fast food and drinking soda, maybe we just eliminate those and not focused on trying to get them be 100% plant-based. So really, take this into consideration. These are ultimately the recommendations, the diets that have been proven to work for remission, but we have to take the individual into account and be realistic. Next one, activity. Activity is the next thing. It's the next tool in our toolbox, and very minimum recommendation based on the American Diabetes Association is that we are achieving 30 minutes of exercise 5 days a week. This is the bare minimum. And for some people, they're already doing this. And for other people, that's not even attainable. So once again, we meet them where they're at. We be realistic in developing goals with the person and help encourage and give ideas on how to achieve these goals. One thing is to consider taking a walk post meal. Walking and exercise helps our body use glucose. It helps our body use our insulin, and ultimately it's going to improve that glucose level. So our glucose tends to be the highest post-meal. And so that is a really good time to incorporate a walk, even if it's short. Building muscle helps with fat loss, and it improves the use of our glucose. Now, whenever possible, whenever appropriate, we need to incorporate strength training. For some people, this might be going to the gym. For other people, it might be doing push-ups and squats. So once again, see what the person is already doing, see what they would like to do, and use your knowledge and this research and the stuff that I'm providing you today to incorporate a realistic plan that we're working towards achieving these recommendations. Okay, weight management. Ultimately, the food choices and the activity level are both working together to try to achieve weight loss. Most people living with diabetes, not all, but most living with type 2 diabetes are carrying extra weight. These people are considered overweight and medically would likely benefit from weight loss. It is our fat tissue that tends to be the most resistant to insulin. And so if we can lose some of that weight that we are carrying, then we can become more sensitive to the insulin that we are already producing. Type 2 diabetes is a problem with insulin resistance. And if we can improve that, we could potentially improve our diabetes and move towards remission. So as research goes, 3 to 7% weight loss is typically required to improve your glycemia and to decrease your risk of complications. Evidence shows that greater than 10% is going to show greater benefits and a greater likelihood of achieving remission. There are some studies and research out there, and if you do a quick search online, you might see things that, hey, remission is really difficult, or remission isn't possible or realistic for everybody. And the thing is without targeted interventions and without intensive lifestyle changes, you see that bullet down at the bottom, the incidence of remission is low. It's anywhere from 1.6 to 4.6%. And this is just showing us, hey, it's still possible, but it is not something that's possible without making significant changes. Because once someone has developed diabetes, they probably have inflammation. They are probably carrying extra weight. They may or may not have other medical conditions. They are already insulin resistant. And there's a lot of things that are kind of going against us. And one of the things that we can do is to lose weight, and that will improve that insulin resistance, improve our body's ability to use this glucose. Now, as you can see in those middle bullets, there are different studies. There's the Look Ahead, Direct, and Diadem 1. These have shown different percentages of remission based on weight loss. And in the Look Ahead, 11.5% of people achieved remission at 1 year, 7.3% at 4 years. This is people with participating in intensive lifestyle interventions for weight loss. The Direct study, 46% remission, which is incredible at 1 year. And this was with at least 10% weight loss. The next one was 61% remission. And once again, that's huge. That's a really good number, but this is with 12% weight loss. So these do not necessarily come easy, but they are possible. So weight is a sensitive topic for many people, and we do need to approach it gently with people living with diabetes. However, I think it is extremely important to address it because it is the one thing that can improve our likelihood of achieving remission. When we achieve remission, remember, 3 months of not requiring any diabetes medications and still achieving a glucose level or A1C that is considered less than diagnostic for diabetes, so less than 6.5. when we do this, we can decrease our risk for cardiovascular events, microvascular events, macrovascular. We can really improve the quality of life. And even if it is just for 1 year or 4 years, that still improves the risk of complications. And I think that's something that's really important to remember, is with those studies out there that are saying, hey, remission is really difficult to achieve, or remission is not realistic for most people living with diabetes. The thing is, they might be talking about long-term remission, many, many years. And that's always the goal. However, any length of remission, any improvement or slowing of the progress of your diabetes is going to improve your health and decrease your risk of medical complications in the future. Over here in the pink, this is just kind of highlighting again that link between obesity, carrying extra weight, and the prevalence of type 2 diabetes. Currently, it is estimated that 1 in 3 Americans, at the rate that we're going and with no changes, will have diabetes by the year 2050. Well, that's a very high percentage. And just like achieving remission of diabetes, just like managing diabetes, our best tool that we have in order to prevent diabetes is weight management, healthy eating, and exercise as well. Okay. All right. Inflammation. I put this slide in here because I don't think you can talk about obesity, carrying extra weight, and type 2 diabetes without discussing inflammation. When someone's BMI or their waist to height ratio is increased, or that they have a sedentary lifestyle, they're not getting out and being active every day, they have increased inflammation in their body typically. And another thing that's very important to note is that adipose tissue, which is fat tissue, is not just for storage. This is not just storing our fat and doing nothing in our body. Adipose tissue is actually an endocrine organ. This means that our adipose tissue, our fat tissue, is actually putting out stuff with our immune system. It's actually increases the risk of developing more fat tissue, and it increases inflammation. It releases all of these different things in our body that increase inflammation. With increased inflammation, we increase the risk of complications because many of the complications are caused by this inflammation. Not to mention, we also increase our risk for other inflammatory mediated processes like PCOS, rheumatoid arthritis, Crohn's disease, gout. So whenever we can, once again, focus on weight loss, carrying extra weight, that intense lifestyle modification, those daily habits where we're making healthy food choice, going on our walk, getting exercise, this is going to decrease our inflammation and decrease our risk for worsening diabetes and decrease our risk for other medical complications. I put everything's in my resources on the page, but I did put the link right here because there's a very interesting but long paper going further into the science of inflammation, obesity, and diabetes and all of these risks. So if you're someone that wants a more in-depth science approach, I really recommend reading this article. Okay. GLP-1s and GIP receptor agonists. I felt like I needed to at least touch on this really quickly because these medications are so popular. If you're not familiar with that name, you might be familiar with the names Ozempic, Wegovy, Mounjaro. These are all medications that are receptor agonists for our gut hormones. In type 2 diabetes, we have a decreased incretin effect. This means a decrease in these gut hormones, okay? When it comes to remission, there is controversy around whether or not a person truly achieves remission or not when they are on these medications. Based on that definition that we already discussed, technically someone is not in remission. But if you are living a good life and you have good quality of life, no side effects from these medications, and they have resulted in weight loss that has led to not needing any other diabetes medication, I think that's a really wonderful thing. So it's okay for it not to be called remission, but based on the definition, it wouldn't be. Other thing I wanted people to know is that our physical activity can increase the circulating levels of GLP-1, once again, which is that hormone or peptide that is helping us feel full longer, helping our body release insulin appropriately in response to consumption of carbohydrates and getting that glucose orally. So just a reminder of why physical activity is so important. Not only is it helping with weight management, it's helping with these peptides. Okay. Small changes make a big difference. I know sounds silly to say, it's pretty basic, but I think it's really important to remember this, whether you are a provider working with people with diabetes, or if you have diabetes yourself, we need to always take a step back and remember this, because sometimes it is not realistic to make any and every change all at once. It is easy to get overwhelmed. It is easy to throw in the towel. So if we can make small, consistent changes, we can make that big difference. We need to focus on our daily habits. We need to be choosing vegetables with our meals. We need to be avoiding soda and those processed foods. We need to ensure that we're getting all of those plants, limiting that meat intake, especially anything that's really high in fat. And if we can just make those little changes in our diet and go on those daily walks, as those become habit and as those become a regular part of our life, we can actually see those big changes. Okay. Progressive nature of type 2. This disease, if it is not, if lifestyle modifications are not done, if it is not intense lifestyle changes, typically type 2 diabetes is known as a progressive disease. But I don't want people to ever get discouraged by the idea of it being progressive, because we can slow the progression and possibly stop the progression by making these changes. So looking at this, as you can see, the onset of diabetes, I don't know if I have a pointer on my screen, if you can see this here or not. At onset of diabetes at 0 years down here on the bottom, you can see prediabetes is up to maybe even 15 years before someone ever even develops diabetes. And then the diagnosis of type 2 diabetes often doesn't happen for 5 to 10 years after that. So a lot of times some damage to our body could have possibly occurred already. So when we get diagnosed, or when we find out, or maybe you're lucky enough to find out you have prediabetes before ever, ahead of time, we can make these changes. And if we make changes soon and try and do as much as we can really lower our risk for decreased beta cell function. As you can see, this bottom orange one going down over the years, hitting that 30-year very low, decreased incretin effect, that yellow one. This is talking about those gut hormones, the things that Ozempic helps with, and our insulin level decreases. All of this is often in response, though, to that insulin resistance. And if we can improve our weight, improve our diet and activity, we can really slow this progression and maybe even stop it. So I really want people to understand that without these big effective changes, it will keep progressing. And important to note that medicine for diabetes, most of it, is really going to help with these top two, that post-meal glucose and the fasting glucose, those top two dashed lines. The medicine can help with that. We can help get it to a safe level, sometimes regardless of lifestyle modifications. But the thing is that is not slowing the progression of diabetes. It is not improving the underlying problem. It is simply getting our glucose to a level where we're hoping to prevent some of the damage to our blood vessels, nerves, and organs. Now, I would, always recommend those changes in lifestyle factors make remission be one of the major goals for diabetes management, rather than focusing on just glucose management and giving medicine and saying, here, take this, look, your numbers look great, because we want the healthy living in order to actually improve this and slow that progression. Okay. So in summary, the big things is that remission is possible. And it should be a targeted goal for everyone with diabetes. And maybe it's not possible for everyone with diabetes, but if this is our goal and we're working towards it, we're making those lifestyle changes, we're going to improve our health, whether we achieve remission or not. Those intensive lifestyle modifications, choosing the healthy diet, choosing to exercise, and hopefully leading to the weight loss is all going to improve our health and our diabetes. The greater the weight loss, the greater likelihood of remission. So I know sometimes this is not what people want to hear. Weight loss is hard. And like I said, weight loss and talking about weight can sometimes be pretty sensitive, but we have to focus on it because the research is there, the best practice is there, the studies, and it all shows the greater the weight loss, the greater the likelihood of remission. And when we get into remission, we are decreasing our risk for going blind, for heart attacks, for strokes, for wounds that do not heal. We want to maintain the quality of life we have, if not improve it, and trying to make daily habits that are moving towards these recommendations and everything we talked about today, that is going to hopefully improve that quality of life and achieve remission for many people. Okay, so here's the resources. There's so much out there, but these are all good vetted sources, many from American Diabetes Association and big consensus articles that are coming from maybe 16 experts. These have all been peer reviewed. And if you want to learn more, all of these are great places to start to get more in-depth information. And that is all for today. And I'm happy to go into further detail about any of these. If anyone has questions or comments, thoughts, any of it.
Well, I wanted to ask, and maybe I missed it when you were on your second slide, you had the word DASH.
Oh, the
a bullet
DASH
point.
diet.
Oh, I didn't know what that was, and I wanted to go back and see if you could tell us what that was.
Yeah, it's just a name of a diet. I'm trying to remember the actual acronym. I think it's dietary. It's something about sodium. It's having a decreased sodium intake, essentially. It's dietary changes for hypertension. Now, ultimately, when you improve your blood pressure, you're going to also improve that inflammation and diabetes. All of these things are really linked. And so it's interesting. You can't talk about one without the other. Typically, you don't improve one without improving the other. So that's a good thing. But yes, it's a diet that was specifically catered to people with hypertension. And one of the focuses is your sodium intake.
Interesting. And you're right, they are interwoven. It seems that, oh, you don't feel like getting off the couch because you're carrying that extra weight. And I don't feel like standing in the kitchen, so it's easier to open a bag of something. And everything just compounds into a health issue. Jen is saying, thanks for defining remission. It is very helpful and hopeful. I wanted to know, do you recommend to your patients to start some sort of journal where they are writing down what they're eating or tracking their exercise? Or do you sit with them and recommend? Is that something people can just easily start on their own?
Yeah, so I work with inpatients. I work in a hospital, and so I give suggestions. We work to set up some goals, but often it's not the time and place to be doing this because I personally do not get to follow up with them, and they're often pretty sick. These are people that are status post heart attack, post stroke, maybe they're newly diagnosed with diabetes. So we provide as much information as possible, but it's kind of a difficult place. I always recommend writing down goals. I think it's very important for each person, whether you have diabetes or not. When you want to make a change, you need to make, the SMART goals, right? The simple, measurable, attainable, realistic, and timely. You need to write it down and make sure you get that R, the one that's realistic for you, because we want to be successful, right? So maybe for somebody that is, hey, I'm going to go on a 5-minute walk after each meal for the next 2 weeks. And that's my measurable, realistic goal. And it's written down so I can more likely achieve it. And it's a reminder to do it. So always write down your goals. Make sure they follow that acronym SMART. And then whenever someone is willing to, yes, I like the journaling idea. I think it's very helpful in the sense that people can see what they are or are not doing. Because sometimes we need that. We don't always remember. And the other thing too, especially if you're someone with diabetes and you're checking your glucose, what's nice is you make those comments and you have your glucose levels and you can see, oh gosh, my numbers look great on these days. What did I do? Or my numbers, are really high here. What happened? And you actually start to associate your habits and your actions and your food with the high or low numbers. And it can really improve that motivation to make the healthy choices that aren't always the easy ones. We can do hard things. Living with diabetes is hard. Choosing the healthy food is hard. Which one do you want? Which hard are you going to choose? Are you going to have a hard choice in the moment? Or are you going to live with a hard complications of making the easy choice in the moment?
Right. Good points. You just spurred a thought about smoking. Like, how does smoking play a part with this? I mean, I'm thinking heart and lungs, and it's easier to sit and smoke a cigarette. So how does that add into the mix?
Yeah, so I don't have any specific statistics or anything written down for it. However, in the world of diabetes management and cardiac management, ultimately, stopping smoking is one of the number one recommendations and one of the most important things people can do, because smoking is going to increase your risk for all of these other vessel diseases and cardiovascular problems, and diabetes and high glucose already increase that risk. So you're really kind of doubling down on the risk of complications. Not to mention other things like cancer and stuff like that, which I'm not an expert on and I'm not going to pretend to be. But ultimately, in the medical world, it is one of the number one things someone can do to improve their health.
Great. And it seems like it just fits right in with this. If you're making changes, that's another one to just get you to a healthier place.
Yes.
A comment came in from iPhone. Thank you for such a comprehensive presentation on diabetes remission. I really appreciate the scientific backed research, and your methods you shared were very realistic. The note-taking habit is such a vital tool to use data to understand how your body reacts to different foods you intake and exercises you do. Going on a walk with my kids right now to put your words into action. So
Well, I love that.
yeah, it's
And,
great.
I liked the words she used. That journaling is data. And I always tell that to the people I'm working with, is that, hey, when you track your glucose, this is not a measure of success or failure. These are not good numbers and bad numbers. This is data, and data is required to make educational decisions. And if you don't have that data to bring to your provider, they don't know if you need more or less medications. You don't have that data to figure out, hey, are the changes I'm making effective? Do I continue to do them? Do I do more? Do I do less? So really remember that it is data and it is not a measure of success or failure.
Great. Everyone, we have another few minutes. I know there was someone who just joined the Edu Talk. If you have any specific questions or comments you'd like to ask Micayla. And with the medications, I'm not that familiar with them, the Mounjaro or Ozempic. But I understand that once you start those, you just are committed to sticking with those?
Most of the time, a lot of the research shows that when somebody stops those medications, they regain the weight that they lost while on them. So typically they are approached as if they are going to be a chronic medication. And I think it's important for people to realize that, and that it's not just a quick fix weight loss medication. And just like all medications, they come with side effects. These medications increase your risk for pancreatitis. There is a black box warning on them for thyroid C-cell tumor, and they slow down your gastric emptying, which is part of the reason why it leads to that feeling of satiety and helps with weight loss. But if it does its job too well, it can slow down your gut so much that people are being hospitalized with nausea and vomiting. I see patients in the hospital here because of direct effects of those medications. So they can be really great. Those GLP-1s and GIP-1s are one of the only diabetes medications that have been proven, and with very good statistics, to decrease the risk of cardiovascular events. Now, they can be very good medications in the right population. All of these meds, everything for diabetes, they do come with side effects. And so you have to weigh the pros and cons and look at the big picture and what is someone's medical complications already? What are they at risk for? And do the risks or do the benefits outweigh the risks?
All right. Good point. I think that's it for the questions I have. I haven't seen any others come in, Micayla.
Okay.
And I appreciate your presentation tonight. It during parts of it, it did spur that we, you said added sugars and carbohydrates, and it also sparked that we have had previous presenters, a dietitian that has presented on reading, not that this was her topic, and they can all be found in the EduTalk Diabetes Archive Library, but the importance of reading labels and noticing. I mean, I was oblivious to the added sugars. Yeah, you just think you're buying something healthy, and then, when they say, well, what's the added sugars? I mean, it opened my eyes, and I should have known better.
Yeah, and there's a lot of food out there, and marketing is a very powerful tool, and people get paid a lot in marketing, that you walk down an aisle and you see things that say keto friendly or organic or non-GMO, and those are good things. But just because they're labeled that way and marketed that way does not mean this is not a highly processed food. It doesn't mean, there might still be added sugar, added fats, added sodium, and a lot of them are still not going to be healthy for us. So reading labels is definitely a skill that I try and teach patients when I'm working with them. And it's something that I know all diabetes care and education specialists focus on, is looking at it so you can determine what is or is not in your own food. Everyone eats differently. Some people focus on just getting whole fruits and veggies and make their beans from scratch and have all of these things from scratch. And you know a lot more about what's in your food when you do that. And that's the goal ultimately. But many people also buy packaged food. It's easier for them. Maybe it's better financially. Maybe it's all they know. And we need to start reading those labels so we understand what we are putting in our body, because sometimes we think it's really healthy and we look at the label and we find out a big surprise.
It is a surprise. And the type gets really tiny, but
yeah, and you need to look at not just so you look at the nutrition label, because that's going to tell you your types of fat, and we want unsaturated fats, not saturated. Okay, that's one thing. You're going to look at your carbs, and that gets broken down into sugars and added sugars. You want to avoid the things with added sugar. But not just there, sometimes it's good to also look at the actual ingredient list. Ingredient list are listed in the order of the highest content. So you might look at something and find that the first thing is corn syrup. And then you realize, oh, okay, well, if corn syrup is the main ingredient in this, maybe it's not the best food. And there can be preservatives and dyes and sugars and fats, all of these different things added. So as you dive deeper into it and want to get more information or focus, get a little more nitpicky with your diet, these are all really good things to start doing and kind of determine what is important to you. Because everyone's going to have a different thing that is more important to them with their food intake. But I think the big thing is starting with, get rid of any liquid sugars whenever we can, sodas, juice, alcohol, things like that. It's often the most bang for your buck. It saves you money and you're not really taking anything away with nutrition, and you're not having to dive deep into the world of learning about nutrition and all of the recommendations. You're simply eliminating something that is not benefiting you. So I think that's always a good place to start. And then any of the processed snacky junk foods would be the second place. And if you're achieving that, if you're meeting that goal of yours, then let's focus on making your plate and meals as nutritious as possible. But I want to get rid of the stuff that's more harmful before focusing on, more particular details.
All right, replacing it with healthier foods.
Mhm.
Meryl is asking, there was a reference to soda. Is soda water a bad thing also, i.e. Soda Stream made soda water all right? Is carbonation bad also?
In my studies and research, I haven't heard anything about carbonation being bad. I've seen things off and on about natural flavors, because it's not regulated and none of us know what is the natural flavor put into this, and where is it coming from. So that's the only thing I can say about that. I love that with sparkling water, it's 0 calorie. You're not consuming sugar. So in the world of diabetes, it is a wonderful alternative to other flavored beverages. As far as like being as clean as possible in your food, I would have to do more research on the natural flavors, I think, to really give a more in-depth, accurate answer to that.
Well, fair enough. I want to thank you again for joining us tonight. And just to mention to our audience that tomorrow you'll receive a follow-up email. It will include the recording of tonight's presentation. It will include Micayla's PowerPoint handout, and it will also have a contact information for her if you have additional questions that you'd like to ask. And please mark your calendar, July 16th. We will have Michael Shea, Causes and Care of Type 2 Diabetes. And for those in the massage world, June 18th, next week, we have Michael Morgan, and he will present on craniosacral therapy and applications for Alzheimer's and dementia. So please watch your inbox. And if you don't see it by tomorrow afternoon, check junk or spam, but watch for the follow-up to Micayla's presentation tonight and for future invitations to upcoming EduTalks. And Micayla, anything in closing?
I don't think so.
Okay.
Thank you all
Okay.
for being here, and good luck with implementing healthy daily habits.
Yes. And, a good place for folks to start with diet is American Diabetes Association has recipes. There are a lot of Facebook groups out there that you can join that share recipes. So those are easy little ways to get information to begin incorporating a healthier lifestyle.
Yeah.
Thank you so much once again. Thank you everyone for joining us. Join us again. Oh, wait, maybe one more chat.
Oh,
Thank you. All
okay.
right. Well, I feel
And
the
if anyone
same.
has questions, my email is on that PowerPoint slide. So it is totally fine if anyone wants to email me for any follow-up questions. I'm happy to chat after this.
And that will be included in the follow-up email tomorrow as well. So thank you so much. And everyone be well, take care, and we'll see you next time.
Thank
Thank
you.
you. Bye.